right, welcome everyone to the STEP Learning Collaborative Family and Community Workshop Series brought to you by the STEP Learning Collaborative, which is supported by Connecticut's DEMIS and DCF and the STEP program at Yale. For today's talk, we have Dr. Toni Gibbs-Dean presenting on strategies for supporting a young person with early psychosis, part 3. And today we're focused on caring for the carer. So Dr. Gibbs-Dean earned her PhD in computational psychiatry in 2023 from the Department of Psychiatry, Psychology, and Neuroscience at King's College London. Toni also holds a master's in psychosis studies and a bachelor's in psychology and neuroscience. Over the past 10 years, Toni has worked with vulnerable populations across multiple settings. As a social worker, Toni worked with young people in the care system, specifically those that were under the care of the state, living in children's homes. Toni has also worked as an assistant psychologist in early intervention in psychosis services and within inpatient hospital settings. Dr. Gibbs-Dean is currently a postdoctoral associate at Yale's STEP program, and she serves as the Early Detection and Assessment Coordinator for Region 3, which is the eastern portion of our state. So without further ado, I'll hand it over to Dr. Gibbs-Dean.
Hey, thank you for that really nice introduction, Laura, and it's really nice to see everyone here. As Laura said, I'm going to spend a bit of time today really trying to focus on caregivers, people who look after others that are experiencing psychosis. We do have a number of talks that focus on psychosis specifically, and I would recommend that if you didn't go to those talks previously, they're all up on our website, and they go into a little bit more detail about psychosis itself. What this talk kind of is going to look at is that when the caregiving relationship is going well, the outcomes for someone with psychosis are greatly improved. But what we also know is that the burden that this puts on the carers themselves can be enormous. It's a huge responsibility that they've taken on, and it can have huge implications on their own lives. So we really want to try and kind of educate around carers, but also recommend some practical ways to try and support carers going forward. So just to really briefly touch on what psychosis is, again, this is covered in much more depth in other talks, but psychosis refers to a syndrome. So it's a cluster of symptoms that can occur across lots of different diagnostic categories. So often you see psychosis is a core part of schizophrenia, but it also psychosis can play a part in disorders like bipolar disorder. During an episode of psychosis, people tend to struggle to differentiate between what they're experiencing as real and what's going on inside their head. So common signs and symptoms, people often experience positive symptoms of psychosis. So these are experiences that add to their normal functioning. So often it could be hallucination. So people see something that isn't there, but it can affect any sense. So people can also hear things that aren't there, like voices. People also experience paranoia, suspicion, and they might be behaving quite bizarrely, and their communication could be disordered. And they may not know that this is what's happening. They may not have any insight into their symptoms. Negative symptoms are also a possibility and maybe less talked about, but they occur commonly, and they look like decreased motivation, flat affect, so not very much emotion showing on people's faces, generally just not really having much energy, not wanting to do stuff, maybe not speaking very much. And there are also cognitive mood related symptoms where maybe memory and general executive functioning declines and people's mood fluctuates. So psychosis is more common than people sometimes think. And actually for each person that experiences psychosis, the statistic is that 5 to 10 other people are directly affected, usually family members and people that live with the person experiencing psychosis. So we're going to drill down a little bit into who these people are and what they're going through. So the caregiver is the term that we're going to use to refer to people looking after someone with psychosis. It tends to be defined as someone who is providing support to someone who's unwell, but they're not paid to do it. A professional has provided this kind of support in, for example, a hospital or an inpatient, but now the carer takes responsibility for those jobs. So it could be dealing with medication, observation, encouragement, and further down the line, help with things like housing and education. Other examples of the caregiving role include, emotional support, financial management, treatment adherence, housing, shopping. So it's a big role, a lot going on. And I think it's important to try and define it. Sometimes this can be a little problematic in the definition because often carers are parents and they would obviously be caring for their child anyway. And we're going to go into a little bit more detail on the role and the differences, maybe the additive role between parents and caring for someone who has psychosis. But just to touch a little bit on the common characteristics. So who are these people? What are their demographics? So as we were saying, parents are a large proportion of carers for someone with psychosis. They tend to be middle-aged adults, tend to be female, and then things like socioeconomic status does vary because psychosis can affect anyone. But we do see that there's a higher impact on the illness for lower income families. And it's important to note that there are a number of other groups of people that also have a relatively high percentage of that look after people with psychosis. So siblings are also common, and spouses. So it's important to acknowledge those groups too. Because parents are the largest group, it's just touching on that difference between parenting and the carer role. Obviously, parents will always be parents, and they have that existing role. They will care for someone because they love them, and that's something that they will always do. But it is important to recognize that caring for someone with serious mental illness, there's additional requirements and responsibilities in that role. So if you think about something like behavioral management in a relatively average developmental trajectory, the parenting role isn't necessarily going to be complex. But for someone with serious mental illness, then caregiver has to also think about treatment compliance, crisis management, very difficult behaviors that we are going to find very difficult to understand given the types of symptoms that psychosis has. And sometimes those symptoms can actually cause, the child to think negatively about the parent even. So there's a lot to deal with there. Also thinking about emotional and psychological impact. Obviously, being a parent comes with lots of stress and balancing responsibilities and careers, jobs, and family relationships. It's quite a standard problem, right? And there's societal support for that. So it's quite normal to discuss that with people. There isn't really stigma necessarily attached to that in the same way as someone who's looking after a loved one with psychosis. There, unfortunately, is a lot of stigma attached to diagnoses like schizophrenia, and people often feel like they can't speak to anyone about it. And it can lead to these feelings of isolation and difficulties there. Again, just touching on the caregiving skills and strategies, general parenting strategies for behavioral issues are widely available. Specialized knowledge that's required to look after someone with a serious mental illness does mean that you have to kind of really go and look for that information, and there may be a steep learning curve associated with it. And there's also legal and financial additions to looking after someone with psychosis, where the costs involved in that care can be very unpredictable and often significant. So just to highlight that while you are also a parent, if there's anyone here who is a parent looking after someone with psychosis, there is this additional thing that's happening. Why are caregivers so important? There's now decades-long research base that consistently shows that when the caregiver-patient relationship is going well and is strong, then there are really positive outcomes for the patient, for the person experiencing psychosis. That includes that the person's more likely to take their medication, and then they're therefore less likely to relapse. They're also likely to recover quicker. They're less likely to have hospital admissions. If they do, those inpatient stays are shorter. Quality of life is generally improved. We also see things like reduced substance use and potentially even reduced mortality. So we can see that it's really important for that relationship to be strong, and what you're doing in your caring role is incredibly important and does have a very, very positive impact. The flip side is also true. So when that relationship is strained and difficult, as it inevitably will be at points, we see evidence that things like critical comments, hostility, and actually also emotional over-involvement, which is this kind of very natural response to want to be very involved in someone who's ill, kind of maybe get a sense of control over that situation, that actually can lead to this more frequent relapses, higher rates of hospitalization, and that kind of thing. So just to kind of highlight that role, the role and the quality of that relationship is really important. Okay, so we've thought about the outcomes for the person with psychosis. But obviously, taking on this responsibility as a carer for someone with psychosis has an impact on the carer themselves, and it's really important to try and understand that. So there are a number of ways that the evidence base shows that carers are impacted. There's obviously a psychological impact. The evidence shows that up to 50% of parents report experiencing chronic levels of stress and emotional strain. Up to 60% of caregivers reported clinical levels of depression, burnout, and emotional exhaustion exhaustion are also high and actually reported to the same levels as people who are paid to work with people with serious mental illness. We also see that the levels of stress experienced by carers who are looking after someone with psychosis is actually higher than people who are looking after people with other illnesses and disabilities. So there's a psychological impact that's important to understand and take into account and appreciate that it's shared and that other people in this situation are also experiencing this impact. Other types of impact socially, that there's definitely kind of an interpersonal strain within the family and within the household that often happens. The statistic that we have here shows 50% reported that within the family there's an increase in conflict. So it's really important to take that into account. Additionally, kind of touching on that isolation point as well, and again, often linked to stigma, people feel like they can't necessarily reach out and talk to their family and friends and people they work with, for example, about what they're going through, and it leaves them feeling very isolated. Also, the caring role takes up a lot of time, and there's maybe not time to go and hang out with people that you would have usually and take that time for yourself socially. There is also financial impact. The costs associated with the caring role, there's medical treatment, therapy, out-of-pocket expenses. These can be unpredictable. There's also this point about lost income, right? Because here up to 30% of parents report that they've had to make some kind of change to their work life. So they might have to reduce hours, take unpaid leave. They might have to leave their job. In some way, their careers are suffering. Maybe their income has suffered also. So again, these are just a few of the impacts. We're just kind of touching on those to highlight that this is something that occurs for families and carers. The caregivers experience. So we're going to kind of have a look now at capturing shared experiences that carers have reported in the past, thinking about a common roadmap. There tends to be these three stages. There's the pre-diagnosis, the diagnosis, and the recovery. And each stage brings with it different experiences, different emotions, and maybe sort of different timescales and approaches. So in the pre-diagnosis stage, this tends to be a period of high uncertainty. Symptoms emerge at different time scales for different people, but it can be quite a drawn out period where your loved one, the symptoms begin to emerge. They may withdraw, they may start acting strangely. This is very confusing. You don't know who to speak to, who to talk to. Obviously, as a parent, as a carer for someone you love, there's high feelings of anxiety, of worry, of fear. Anger is also common, and I guess a response to feeling like you don't know what to do, feelings of frustration. And also despair is very commonly reported. There doesn't seem to be a way out. There doesn't seem to be a solution. All of these things are very commonly reported in that pre-diagnosis phase. The diagnosis stage, people report feeling a sense of relief and hope because now other professionals are involved and it's not just the family dealing with the situation. And it feels like there maybe is a roadmap, a route towards recovery at this point, but that doesn't mean to say that the worry and the stress is over. Often people have had to advocate very strongly to get the best support that they can for their loved one. It can be incredibly stressful. There's also this rapid learning curve where people have to learn about medication and services and who different medical professionals are and how they link together. So there's a lot to deal with during that period too. The final stage is recovery, and this is the kind of speed kind of adjust. So in the pre-diagnosis and diagnosis phases, there can be crisis moments which everything is moving very quickly. In the recovery phase, things slow down and it's more kind of focused on the potential for a longer term life adjustment, which generally involves the need to process what's happened. And it's really important, I think we really focus on patients in relation to this recovery period. And we know that it's, while it tends to be a general increasing trend of recovery, there are like ups and downs within that general increasing trend, but there's less focus on the caregivers. And I think it's important to note that caregivers also need to go through their own recovery phase because this journey has been gone through together. It's not just the patient. So we're going to touch a bit more on acceptance actually a little bit later on too. So we're going to talk a little bit about common experiences experienced by carers. And again, just to just to highlight, these are just a few that are talked about that carers have kind of spoken publicly about or we've heard in the clinic. It's not to say that these are everything that could be experienced. That's obviously incredibly broad, but hopefully talking about some of the more common ones could be useful. One of the really common things that people talk about is this sense of mourning or grief and loss for the relationship that they had with their loved one. For example, it could be loss for maybe opportunities that they feel their loved one is going to miss. It might be loss in relation to their own, the carer's life themselves and how they feel like things have changed beyond a point that it isn't going to go back to. And there's a sense of grief for that. And we're going to touch a little bit on ways to move past those difficult emotions in the following slides. There's also this sense of guilt and responsibility that carers often feel for the people that they're looking after. And I guess that makes a lot of sense, especially if it's parents that we're talking about who generally feel a sense of responsibility for their children, but often report that they feel that they didn't manage their child's behavior properly or something, and then that's what's caused the illness to develop. That categorically isn't true and can't be the case. And it's important to recognize that feeling is shared by other people, and when we bring it to the forefront of our mind, we can rationalize it a bit more and understand that isn't the case. Psychosis can't be caused by parenting, and we can maybe process that difficult emotion a little bit. There's also the common experience of, because people with psychosis are usually young people, so it's usually people have their first break between 16 and 35, so they tend to have maybe just moved out of home and gone to university, or moved out and got a job, and then they develop psychosis, and often they have to move back home. So that is also, like, adjusting to that experience is also very common, and dealing with that household tension that comes up because of that move back and because of having to be looked after again and refilling those roles that maybe you'd all kind of moved on from a bit. And we also have some tips and tricks for that later on. Other common experiences, advocacy. Carers report that they've really had to fight for the treatment, and that's been incredibly stressful. There's been this huge learning curve, learning about medications and prescriptions and side effects, and also this feeling that nobody's listening to them and frustration and nobody understands. A common stress response that's reported, this is a natural human reaction to extended periods of high anxiety, of very stressful situations. It's very normal. So burnout, the symptoms of this kind of thing look like anxiety and worry. You have preoccupation, lots of your thoughts are going towards worry and fear and stress. You might feel tired all the time. You might be very run down and be catching all of the bugs that are going around. Difficulty sleeping is a common one, difficulty with focus and concentration, and maybe a shorter fuse. Maybe you are quick to anger and you have less patience for things that you would normally. This tends to lead to people to not take the time for the self-care that they need, and it feeds into this negative cycle. So we often hear carers saying, there isn't time for themselves. When would they take time to do self-care? And and even if they did have the time, you find half an hour where you could read a book or you could go for a walk and do that self-care activity. Actually, you're too tired, and that feeds into this negative cycle. This can lead to actually not being able to fulfill the caring role that you really want to as well as you could, and actually maybe even relationship breakdown eventually, because you're feeling so bad and you're unable to recover, and you're so depleted in your own energy that it affects your relationship with the person that you really love and you're really trying to help. So it's really important to focus on self-care and find the time to do that kind of thing. So now we're going to look a little bit at what carers have reported to find helpful, look a little into the self-care. So supporting your own well-being is one of the most important things that you can do. It perhaps sounds obvious, but people don't do it because they're so focused on looking after their loved ones. So we're going to talk through a few of these things. Accessing your own therapy is super important. If you can do that, you should, whether it's individualized therapy or it's group therapy. Taking the time and space to talk through your own experience of what you're going through is just so important. If you can't pay for therapy, or you can't find those options, talking to friends and family can also be really helpful, or journaling, writing it down, trying to trying to organize your thoughts in a way that isn't just inside of your head. Engaging in stress management. So I think these things feel very obvious, that it might even sound flippant, but getting proper exercise, eating well, and sleeping well are so important to form a foundation for you doing this incredibly difficult task. And so if you are able to manage those things, you might find that other roles and responsibilities that you have fall into place a little better. Getting into a regular pattern of sleeping, making sure you get sunlight at the right times, and trying to do some exercise, like outside if you can, is very, very important. Carers report that their realization that the role that they've taken on is a marathon and not a sprint is incredibly important and something to think through. So that looks like kind of taking one step at a time, and connects to this idea of acceptance of the new norm, which we're going to talk through in a little bit. Carers also report making the effort to take back control of some of your time, which feels very difficult and insurmountable perhaps initially, but is incredibly important to your own mental health and ultimately the caring role. Taking the time to think about the hobbies, things that you value, and taking the time to do those, even if it's just a small half an hour a day or even like an hour a week. Making that point to do that kind of thing is very important. Accept help where you can, accept it, and where you can, delegate tasks. Give yourself a break, be kind to yourself. All of these things are incredibly important. I think it's easy, particularly when you've gone through crisis situations, to feel like to get into the habit of doing everything and trying to control everything. But actually, especially as things relax more into the longer term recovery period, then it's important to look around you and see who else is around to help. Proactive planning and prevention strategizing. So we're going to go into a few tools and tips for that, but that is a really key way of finding ways to get back your time. And then finally, empowerment is the other kind of dimension that carers report. So this is where people feel very empowered when they have educated themselves about the illness, about things like medication, about services, and obviously attending and watching these kind of videos is very useful, is what kind of fills this bucket. So obviously you're the kind of people already doing that sort of thing, and it's reported that is incredibly useful for carers. Skills building, so looking for ways to, I think this is normally thought about in how do I build skills and how to speak to someone that has psychosis, how do I communicate well with my child who's experiencing these symptoms, that kind of thing. That's really important, but also skills building in relation to yourself and how you're dealing with this difficult situation, and kind of character building, emotional control, and all of these kind of things can be incredibly poignant and useful skills that you can build for your own life, and building positive relationships with services. So we'll talk a little bit now about the specific skills training and resources that we're going to highlight. It's not to say it's not, there are lots out there as well. So first going to touch on this idea of practicing acceptance. So what we mean by that is the idea that while this is an incredibly potentially unfair situation, it's important to accept what's happening, accept that your loved one's diagnosis, for example, accept your caregiving role as a choice. Like we were saying before, this is an incredible action that you're doing for someone that you care about, and really taking on the idea that is a choice that you've made can be an incredibly powerful thing to do. And then acceptance of the longer term changes that this might bring, both to your child's life or your loved one's life, but also to your own and to your family. And the importance of doing that is that it really supports emotional resilience. So acceptance helps carers to acknowledge and manage their own emotions without becoming overwhelmed. And actually, in doing that, by taking stock and having that level of acceptance, you're then able to see the silver linings in your loved one's development. So rather than resisting all of the things that have happened, once you've accepted them, you're able to maybe take joy and pride in the achievements that they make. into their recovery and going forward. The idea of acceptance is also shown to reduce avoidance. So by confronting the reality of the situation, you're actually able to find practical solutions and emotional ways to cope with the demands of caregiving. This is going to lead to an improvement in the relationship quality. So instead of sort of resisting the symptoms or resisting the situation, it means that carers are then able to better maintain positive and supportive relationships with the person that they're caring for. So there are a number of therapies that put acceptance kind of at the core. One of those is acceptance and commitment therapy. So if you're interested, I would recommend reading up on this kind of thing. We will include some resources at the end in relation to it. But it's a therapeutic approach that really emphasizes accepting difficult thoughts and emotions rather than trying to change those thoughts and emotions or avoid them. And the therapy suggests the ways in which you can achieve this is by practicing mindfulness and self-compassion. So really trying to take a step back and think about the thoughts that you're having, trying to take a non-judgmental and kind of caring look at what your brain is kind of ticking away and thinking about when you're not paying attention. Is it constantly worrying? Are you sort of always stuck in the future? Are you still maybe in a bit of a crisis mode? And then it's about fostering that self-compassion and really taking stock of not only compassion for the person that you're caring for, but looking at your own self and trying to build that self-compassion and understand that you're doing your best. The ACT therapy also uses this idea of value-based actions. So that's thinking about and identifying your own personal values, working out what's important to you, what's important to your loved one, how those things overlap, how those things may differ, and then really prioritizing those things. So, and that should look like prioritizing self-care, how it would look to seek support, and trying to maintain a focus on the well-being of both your loved one and yourself in order to really work through that. We have some resources available at the end, and you'll be able to access those once the slides are made available. So there's some worksheets there that might help with ways to achieve these. Processing difficult emotions. So these are things like grief, mourning, loss. We also talked about guilt. There's also some trauma. These things are not something that can be shied away from for long anyway. And in dealing with them, you will improve your relationship with the person that you're caring for, and you will hopefully feel better in yourself too. So again, the tips for kind of working through those sort of emotions is talking therapies, journaling, writing a diary, basically trying to get outside of your head. In terms of grief, those feelings of grief and mourning and loss for what life used to be like and comparing it to what it is now, we suggest trying not to compare your loved one to how they were before the illness, and look to try and measure progress on a day-to-day basis or week to week or month to month. And that can really foster this sense, once that kind of you've gone through this acceptance, you're able to then think about progress on this shorter time scale. Then you're able to have that pride in the small successes that get bigger over time, and really recognize those silver linings. Carers report once they get to this point is that they actually have this really deep bond with the person, even deeper than it has ever been before with the person that they're caring for. Holding hope for recovery for your young person, getting back to the things that is important to them is really key. This might not be the path that you expected them to take or that they expected to take. Other things can become important to them, and they're just as useful to work towards. And we commonly say to people, temporarily lower expectations, but maintain aspirations. So some tips for worry and problem solving. In general, people report feeling very overwhelmed, but they spend a lot of time worrying, and the problem feels unsurmountable. So again, these solutions could feel a little simple, maybe simplistic, but they are incredibly useful. So I would really recommend trying to use them. It's really important to try and find a dedicated time to sit and actually think through these problems and try to make them incredibly specific. So instead of them being these broad, unspecific issues that you just generally feel worried about, trying to really drill down on what the specific problems are. Write it down. Again, getting it out of your head is really important. Talking to someone, and using these SMART goals can be really useful. So trying to arrange your problems into goals and solutions that are specific, measurable, achievable, relevant, and time bound. So I think we include another worksheet and information on that. Record keeping is also can be really useful. Carers report that once they kind of got on top of record keeping, so service interactions, medication, that kind of thing, and being organized about that can be really useful. And pre-planning, so if you know that there's a difficult event coming up like Christmas or a birthday, putting together strategies with your loved one even, and with other family members and even professionals where relevant, can be really useful. And that links on to this pre-planning idea for early warning signs. So we talked about recovery earlier, and while it's generally people recover in an upward trajectory, there are kind of some ups and downs within that, and it's really important to try and plan for maybe the dips. So everyone's relapse signatures are different, and so it's very important to think about those before the relapse or the dip happens. These symptoms can look like pacing, restlessness, nervousness. They might stop taking their medication or increase drug use. You might start to see the reemergence of symptoms where they're responding to voices, for example, or their mood swings might get worse. Working together to make a plan, so you know what's going to happen, you know what you're going to do if that happens. Your loved one knows what to do, and maybe their insight won't be so good when the symptoms occur, but you've gone through this plan together to make the best of the possible situation. And if you can get a professional involved as well to support with that plan, know who you're going to contact, that can really lessen anxiety moving forward. And finally, reducing household tension. One of the really common problems that carers talk about is this increased household tension. So this is some more general tips for things to try and hold on to. Try to maintain a calm home environment. So what we mean by that is to make it predictable, and to try and keep stimulation as low as possible. So try to limit the sudden changes, like big events happening unexpectedly. Try to prepare your loved one for anything that might happen. Obviously, that is not always possible, and we can only do our best in these situations. That could be a goal. Keeping stimulation low, so not having lots of people showing up to the house, like loud noises, this kind of thing. The evidence shows actually as calm as you can make it is good for the patient. Try to take the emotional high road. Again, that's easier said than done a lot of the time, particularly with someone looking after someone who's dealing with such intense symptoms. What we recommend is to try to maintain emotional neutrality and be as non-reactive as you can. Try and take yourself out of a situation rather than reacting in the extreme situations. If someone's showing signs of florid symptoms, then we recommend that you try to suspend disbelief rather than denying their experience. So if they come to you with symptoms, then instead of saying that that's not happening, you're not right about that, really just being curious about what they're experiencing and acknowledging how that must make them feel, not accusing them of lying. So just maintaining curiosity. We recommend that you try to complement the positives rather than focusing on the problem behaviors, and where possible, just to ignore the troublesome behaviors that aren't. Try to allow more time for responses. So someone with psychosis, we talked about those cognitive symptoms previously, they may just be taking a little bit more time to process what has been said. And so they may take a little bit more time to respond back. And finally, just be consistent. Try to be consistent with your interactions. We also recommend this collaborative approach rather than sometimes, which I think can feel very natural, which is sort of to try and control and support in every way. But instead of that, trying to be a bit more collaborative, take a team-based response with your loved one. So try to take advantage of calm moments and have conversations about how they're feeling completely without judgment, and use that time to kind of problem solve together and make plans and strategies of how they would like to deal with the situation and what they think is going to be useful to do, and really listen to that. Friending is something that's very important. If you have shared interests and goals, then really building on those and taking the time to do them can be really useful. So just to finish, this slide will All of the slides will be available after the talk, and these links you can just click on those and it will take you to the various resources that I've signposted throughout the talk. If you visit the STEP Learning Collaborative archives, we have loads of videos and educational trainings and tip sheets that we recommend that you take a look at. So just to finish up, as a reminder, we are looking to get people across Connecticut who are experiencing a first episode of psychosis into care as quickly as possible. So we screen people for psychosis who call our number, which is just listed at the top, and then we provide rapid access into one of these, the outpatients that are shown on this map here. So we have a collaborative, lots of different mental health agencies that have joined us, and we get people into those mental health facilities as quickly as possible. The STEP Learning Collaborative also provides provider trainings, and we also have a consultation line. So any professionals who are working with and trying to treat someone with psychosis can bring that consultation line and speak to specialists. That can be found on our website too. We also provide family and community workshops like this one. Thank you for listening. I hope you found this useful, and please feel free to get in touch if you have any questions.